Good. Well, so good afternoon, all the people. First of all, would like to thank you so much for participating in this webinar and also to be present here. I would like to say some few words in the beginning. This webinar today is about the integrating medical devices, wellness applications, and electronic health records. What is the role of the European Electronic Health Record Exchange format in this point? Also, I started to explain some housekeeping rules of the webinar, and then if you would like to take any comment, any point, please use the questions. Next slide, please. Yes, the housekeeping rules of the webinar is very simple. So basically, just the speakers are allowed to speak and use the camera and the microphones. However, all the attendees can communicate with us through the question and answer button. So if you see down on your screen, you can see the question and answer button, and then you can chat and put some questions on it. All the XpanDH webinars are recorded and now allow also including our YouTube accounts. So you can see all the previous webinars and also disseminate it. In the end of the webinar, we will show a QR code with all the links from the project. And so you can dive a little bit more in the XpanDH and good other points. First of all, I would like to introduce Henrique Martins, that is the coordinator of XpanDH, and also he will be the moderator of this webinar. And for now, he will be the speaker for you. Thank you so much for all the attention, and I hope that you enjoy a good webinar that we have prepared for you. Thank you so much.
Thank you very much, Anderson. And I see that for some reason you have my name on your window, but just so everyone knows that. But and thanks for all the good work. I want to say this publicly, managing XpanDH. As you all know, XpanDH is project, this coordination support action, basically stimulating the ecosystem to mature, to embrace the European Electronic Health Record Exchange format. And in that spirit, when we wrote the proposal for this project, it was quite close, April 2020, very close to the date, the 3rd of May, when the European Commission submitted the proposal of European Health Data Space. Now, we are about more than 2 years after that. We have a new regulation that has been voted by the European Parliament. And not to our surprise, but to our pleasure, the regulation is even more challenging. It talks about wellness applications, and it talks about the connection between them and electronic health records in one of its articles. And when you start discussing with the ecosystem, what is a wellness application, what is a medical device, you soon find out that both of them are consumer-oriented services, but the distinction between them is, I think, at least from my preliminary conversations with Petra, Pier Angelo, and Mikael in preparation of today's webinar, it's not clear-cut. So it is my honor to stimulate the debate between our three speakers today. So I will quickly shut up. We want to listen from them. They have experience from different ranges. Although in today's world, ladies and gentlemen, or gentlemen and ladies, is more or less the same, in this particular webinar, we're starting Petra, who has made significant advances to Label to Enable project, and she will bring her perspective, not just from that project that she so brilliantly coordinated, but also from her experience in standardization, labeling, in communication about products and services in different activity. So, Petra, I would like to invite you to take the floor, the digital floor of our webinar, and convey to us and to all our participants your ideas. I would like to re-emphasize that feel free to send us Q&As. We also know that some of you will consume this webinar later on in offline mode in a few weeks when you are on the summer break. But if you're joining us live, do feel free to send questions. I will make sure they will be injected. Petra, over to you.
Thank you, Henrique, and thank you for inviting me. Integrating medical devices, wellness applications, and EHRs, what is the role of the European Electronic Health Record Exchange format? I will focus a bit more on the wellness applications. Next slide. And I'll show you a bit why. On the left, you can see the CEN ISO 82304 Part 2. That's a whole mouthful, but health hub quality label, standardization. And Henrique asked me to, in particular, look at Article 31A of the European Health Data Space Regulation. And this is it. This is Article 31A. And the way I look at it is we are creating this health hub quality label. And that means that we are looking at, okay, if we would like to assess conformity, how do we do that? And I've highlighted a few things in blue that are relevant from that perspective. So Article 31A.1 says that if manufacturers of wellness applications claim interoperability with an EHR system after relevant conditions are met, one thing we can do is what are those relevant conditions and are they met? And probably that refers to Article 23 and Annex 2, because that's what is mentioned elsewhere. But it's an assumption. We don't know yet exactly. So in part, we will need to wait until implementing legislation. When manufacturers of wellness applications claim interoperability with an EHR system, the users of such wellness applications shall be duly informed. That's, again, something we can check. And it's a bit more clear-cut. The second part of this article, apart from other things, says that if manufacturers of wellness applications claim interoperability, then they shall ensure that the user is able to choose which categories of health data they want to insert in the EHR system. So again, we can check, is that possible? And the circumstance for that sharing. That's not, I haven't found yet that that is somewhere defined, but that's interesting to know. It might be, do I do that in an automated way or when certain conditions are met? We don't know yet exactly. Next slide. This article, the 31A, also referred to Article 8B. And that said that natural persons have the right to insert information in their own electronic health record, and that it should be clearly distinguishable as inserted by his or her, by the natural person himself or by his or her representative. The latter part, so who has inserted it, is again something probably we can take a look at. And the right to insert information, I'll get back to later on, because I have to do with what is it says now on paper, and which is not yet fully final. But yeah, it did bring about some more thoughts on one of the next slides. And one of the things that I know that Mikael will say something about as well, so I'll keep this short, but what is still puzzling a bit, or not entirely clear cut, if I want to call it that way, is what exactly is a wellness application. I think so far we cannot say that anything that is in a medical device is a wellness application. And one of the things that is mentioned here, so it could be both an appliance or software, for processing electronic health data. So that's the condition which not all wellness applications have. But of course, if you want to be interoperable, you need to be able to provide something. And then it's narrowed down to providing information on the health of individual persons or the delivery of care for other purposes than the provision of healthcare. and that will say something. I'll get back to that in a bit. And then what exactly is an EHR system? So the interesting thing is wellness applications. It's not supposed to be used for healthcare. So likely it's mostly providing information on the health of individual persons if you want to get it in a healthcare system, which is an EHR. And then it's narrowed down again to priority categories of personal electronic health data, and to be used by healthcare providers in providing patient care or by patients to access to their health data. So this is on our journey. What exactly does it say here? And a bit taken from my perspective. Next slide. So interesting here is what exactly is care? And care is still a professional service, so not the informal caregiver, to address the specific needs of a person on account of impairment or other physical or mental condition. So you should have something, and then the purpose is to carry out essential activities of daily living. Still, it might be quite difficult to narrow it down what exactly is and what isn't. Healthcare is referred to as health services provided by health professionals to patients to assess, maintain, or restore their state of health. So this is a bit the puzzle. What exactly are we talking about, and when does it apply, and when doesn't it apply? Next slide. And if, again, I'm a bit guessing at this stage, I would say it probably mostly applies to patient summaries, going back to how we have a right to put our own data in an electronic health record. So that's why that's blue. And next slide. And that article refers to, well, it could be this and this and this type of data. So far, I would guess we're narrowing it down to it's the patient provided data, perhaps the plan of care, although that might be the plan of healthcare. So we don't know yet, but a lot of the other things, I would guess that they're not taken from wellness applications. Next slide. This is an article by Atul Gawande, Why Doctors Hate Their Computers, which is something that I always keep in the back of my mind. And what he tells, he's a doctor in Boston, is that an electronic health record has a lot of different purposes to it. And one of the things that I think we should be mindful of is how do we make it usable for everyone still? While he was already complaining here quite clearly on, so this was 2018, that we should be mindful of how do we make it workable for the healthcare professionals involved. Next slide. So the topic of today was about the European electronic health record exchange format. And again, I've highlighted a few things where we can, from the perspective of the label, mean something. So intent is to ask about, does your health app support the European electronic health record exchange format? How exactly that is to be tested, I don't know yet, actually, but there are other projects working at this, but this is something that we think would be useful to mention in our health app quality report, which is the detailed version of the label. The blue parts were the priority categories of personal health data. So that's again the list that I showed previously. This does seem to matter to applications, different software applications, devices, and healthcare providers. In a number of cases, it's a bit difficult to see what exactly should be done in the EHR and what exactly should be done in a wellness application. But then again, it also says that the Commission may extend the categories of electronic health record, and then the whole thing will expand again. in any case, it also mentioned that it could be for primary use. So in short, a number of things still need to be clearer from the implementing legislation and from the final version when it is officially published. Some of the things we don't need to know yet that specific to already say, okay, we can work with this, but not to to do too much in the direction of Mikael. I think I could already say that the number of health apps or wellness applications to which this applies may be really limited, but let's see how it evolves. Thank you. I think this was my last slide, or if did I, yeah.
Thank you very much, Petra, for your good summary of the questions at hand, and you already provided a hint of your sort of opinion to steer up the debate. So maybe a small application scope, but let's see. I think Pier Angelo disagrees with you in some aspects, which I'm pretty happy to see. I hope he can stress the points where he disagrees with you so that we start stimulating the debate. ICT manager at BI Health is Pier Angelo has had a track record of working in standardization areas and is now looking a lot into consumer products and quality of consumer products. So over to you. Floor is yours.
Hello, everybody. Again, thank you. Also on my behalf, thank you, Henrique, and thank you, XpanDH project, for giving me the possibility of talking about the EHR format and interoperability and XpanDH. Next slide, please. Okay, let's go directly. This is the topic of what I would like to talk about. Okay, now my provocative question is, can we go ahead with using between brackets, between quotes, just medical devices in the health domain to interoperate with EHRs? Well, not only EHDS, the electronic health data space and standards. For example, the technical specification that Petra was talking about in her presentation would say no. But I would add to that no also the fact that already the second part of the article that Petra showed before, that the patient is allowed to insert data into her electronic healthcare record, is actually being done in several countries, including my country, Italy. And the patients, the assisted citizens, can load data of diverse types, not only laboratory reports, but also their what they feel are their symptoms, their history, and also data coming from fitness and well-being applications. So the answer is could monitoring of wellness and well-being and fitness end up in the electronic healthcare record? Well, I would say yes. And how do we actually allow to fulfill the EHDS point about how should they conform? Should we guarantee conformance of these applications, these apps, to actually interconnect them? Well, my answer is quality of the data and quality of the app is how to do it. And actually, it can be done. Next slide, please. I've added, just for the convenience of the reader, 3 slides with definitions. The wellness application definition of the EHDS has been shown before. So I would go directly to the next slide. Please, thank you. Now, this is the definition of health and wellness apps coming from the technical specification, quality and reliability of health and wellness apps. And for me, it's very important. Actually, it's very important for many because there's one definition which actually covers health and wellness apps. That's right. Health apps, which are medical devices, and wellness apps, which are not medical devices. And the rationale behind this is that if we want to provide quality for wellness apps, these have to be in one way or another conformant to the same quality criteria as health apps. From a certain perspective, this may seem a burden to the industry. Actually, it isn't, and I'll explain this later. Next slide, please. And I wanted also to expand on wellness apps. Actually, wellness apps fall under what is commonly known as digital consumer health products. In general, consumer health encompasses a broad range of direct-to-consumer products. So we have different examples: over-the-counter nutritional, personal care, and patient care products. And before the digitalization of these consumer health products, this implicitly meant non-prescription or wellness products. Now, when we put both the term digital in front of that, we have a lot of expansion. Health and wellness apps, we gave the definition before, but if not also health software and health software product. And this is described in a deliverable of the XpanDH project. So expansion towards digital consumer health products and not talking only, between quotes, only of wellness apps. Please, next slide. When we talk about interoperability with electronic healthcare records, we're used to talking about interoperability with hardware medical devices, but actually the scope should be extended. We're talking also about digital medical devices. For example, software as a medical device. So software which is intended to be used for medical purposes without necessarily being part of a hardware medical device. We're talking about digital therapeutics. So technologies whose active ingredient is an algorithm. And we're talking about, at this point, health and wellness apps, which I gave the definition before. So next slide, please. Now, let's take a step back. Very often, it's difficult for healthcare organizations to acquire or clinicians or stakeholders to actually decide which digital health products and services need to be, for example, integrated with electronic healthcare records. So many hospitals acquire these elements without actually being aware of the real quality of what has been acquired. And I've heard a lot of these lamentations, not only in my home country, but also throughout Europe. So we need to evaluate the quality, we need to fight the lack of trust, and we need to solve the lack of information of these products. Next slide, please. So we need to apply the concept of quality labeling, quality labeling through quality criteria frameworks. In order to support the creation of quality wellness apps, not underestimating the quality of the health data, which is actually transmitted by the applications or digital consumer health product to the electronic healthcare record, and allowing the the application of innovative and safe methodologies so that we can integrate them with the electronic healthcare records, but also local and regional information systems. And we need also quality framework to support the regulatory component. Next slide, please. So talking about the trust, we need quality labeling to guarantee that the professionals and the patients using these tools do not lose the quality that they are used to in healthcare. Meaning trust of patients, healthcare professionals, and decision makers in using and prescribing and providing these digital tools. Now, actually they get better and improvement in terms of the timeliness, accuracy, and quality of services from the point of view of data protection and security. Next slide, please. I'm hurrying now because I need to finish quickly. Now, getting back to the suppliers, if the suppliers know in advance what are the quality criteria from standards, super partes standards, if they know these in advance, they can actually do that and focus on their own added value, their innovative drive, and access the global digital single market. This means that they already know in advance what they have to do to be conformant in terms of the EHR exchange format and other interoperability issues, and they can focus on their own innovative. So actually, it's good for the industry. Next slide, please. Petra already talked about the quality and reliability of health and wellness apps to technical specification. And this has been the starting point for a lot of other works. For example, the next slide, please. For example, the quality criteria, which has been which has started from the quality criteria in the technical specification and has been applied to digital consumer health products. It has been applied also to telemedicine products, solutions in Italy, for example, but it has been the basic starting point for identifying quality criteria for other things. Next slide, last slide. We have, in fact, extended those quality criteria to conform to digital consumer health products, which include wellness applications, including, and here you see in the 5th point, robust build, which includes interoperability requirements and data requirements, which are shown in the next slide, the last slide, the really last slide. Okay, as I was saying, this is the last real slide in which we have identified interoperability quality criteria for digital consumer health products, which is an extension of what was already in the Wellness App technical specification for both interoperability and data quality. So we need to, and these include also the EHR exchange format. I will stop here. Sorry for going a bit long with respect to my 10 minutes. Thank you.
Thank you very much, Pier Angelo, for this presentation. I think if we were already confused between wellness apps and medical devices, now we have these new creatures, as you call them, digital consumer health products. And I guess services. You also mentioned telehealth, but I think it's this landscaping of the complexity that we cannot avoid. And you also provoked us into you used the word burden to the industry, and I guess this is a good motto to invite Mikael, founder of SenseTrend, a company that I've learned to know now from more than one radical health festival in Finland. And of course, Mikael is also active in other areas like HL7 efforts, both in Finland, but also as a FHIR ambassador. And I guess, Mikael, before handing it over to you, I mean, is it easy for the industry to map this complexity? Would it be useful to have 2 or 3 materials, as call them, bundles in terms of format definition that would help understand how do you connect a health wellness app both to the EHR and already to make prepare for the discussion. why then, I mean, you did provide a difference, but why then use always health and wellness if they're different? So where's the boundary? Sounds difficult. And also for Petra to start preparing herself. I also feel people can feedback allergies and a few other things. And we have a question on the chat on should care only be provided by professionals, by not next of kin? And I guess we didn't write the regulation. The question really is, why did the regulation feel the need to have a very restrictive interpretation of care? And how does that also influence how we look at care and healthcare and wellness as a basis to define a continuum? Was just to give you time to warm up, Mikael, and over to you now. And again, I want to emphasize everyone following our webinar, just feel free to chip in. There's no silly questions. Any question, even the most simple ones, they will trigger our speakers to use their wide knowledge to the benefit of your question. So make use of their. Mikael, over to you.
Thank you, Henrique. And your question, is it a burden to the industry to map these different concepts? I wouldn't say so. I think the industry is quite well aware of different concepts and which are medical devices and so on. I think the EHRs specific regulation struggles a bit on that, but the industry not so much. The biggest struggle for the wellness app and also medical device industry is the business models. And I'll come to that later on. As mentioned, I'm the founder of SensoTrend. That's a startup focused on diabetes. So we make all kind of smart apps that make living with diabetes easier. And I also have the grandiose title of Fire Ambassador of HL7 Finland. And in that role, I promote the use and uptake of HL7 standards. Next slide, please. Thank you. And you've seen this a couple of times, but perhaps with different emphasis. My emphasis here is wellness applications are meant for other purposes than healthcare. And this is really the biggest gripe I have with EHDS specific regulation currently. So why do we talk so much about wellness applications if that's something that is meant to be completely outside of healthcare? Is there anything that's really necessary for those kind of apps to integrate with an electronic health record system? Next slide, please. So this is in the recitals of EHDS, and it says that why wellness apps are mentioned here. It's necessary to enable the procurers and users of such products to find interoperable solutions for their specific needs. And I really claim that for an individual, it's not a really mandatory point when I purchase a wellness tracker that yes, it can write data to an EHR system. And the other part is that the healthcare professionals, healthcare organizations that would be procurers are not procuring wellness apps. They are procuring medical devices that are meant to talk to the EHR, but not wellness apps. So wellness apps are mainly provided by the direct-to-consumer model, where consumers actually procure them. And for them, interoperability with an EHR system is not mandatory. Next slide, please. So based on that, this is my official prediction where it stands with the EHDS as it's written today. We're really lucky to see 10 wellness apps claiming conformance with an EHR system in the first 5 years of EHDS. And after that, we'll probably see some different kind of legislation because we can see that this legislation is not working. And really, my point is that there's not enough incentive for these wellness apps to do so. And where I really see that would be, can we still go back to the previous? So I think we can see many, medical devices that want to claim conformance with the EHR system. However, those are excluded in the EHDS, and I'll come back to that later. And I also think that we will see wellness apps that are labeled with the label to enable label, because again, that's more valid to actually inform both consumers and healthcare professionals. Yes, this is a wellness app that has been evaluated, and there is some quality criteria for that, but not necessarily when the medical industries or the medical profession is purchasing those apps, because they are not purchasing or procuring them, but they might be recommending those to their patients, and that's a different model. So I think label to enable is a valid concept. I'd like to see that adopted, and I think it will, but I think the conformance with EHR system, that's more important for medical devices. Now, next slide, please. And this is my current thinking around this. So in the impact assessment, there's some language saying they evaluate different options for EHDS, and one was the really lightweight and one was the really heavyweight, where this labeling and certification was mandatory, and they selected that the certification of wellness apps and medical devices should be voluntary. And then they dropped the medical devices off, and now there's only this voluntary label for wellness apps. But they do mention a cascading effect in medical devices. So that's currently my cue, how I read EHDS. Yes, there was probably a lot of lobbying from the medical device industry saying that we don't want any more regulation for medical devices. And there is no lobbying party for wellness apps. So the legislation, I think, this is a hypothesis, I think the legislation was switched so that, yes, we make this voluntary for wellness apps, and we don't say anything about medical devices yet. But once we have this specific, this structure in place where you can claim conformance to an EHR, we hope that some medical devices will voluntarily adopt it as well. Although right now we are writing it in a way that it's only mandatory, only applicable for wellness apps. Next slide, please. Yeah, again, I already said that this is really meant for the users of products. Next slide, please. So why are medical devices excluded from the EHDS? If you read the regulation, it really talks of wellness apps and electronic health record systems. It does mention medical devices, but it says that medical devices are handled elsewhere. For instance, in the medical device regulation, MDR, that came into effect in 2017 and has been a really painful journey for the whole industry. So we originally in 2016, we knew that the MDR is coming into effect. We wanted to start doing our quality systems according to that already in May 2017. However, it took the officials, the regulatory part, 4 years of the 3-year transition period to get their stuff ready. And only now we are in the transition period until 28 from Medical Device Directive, the older regulation, to MDR. So MDR has been a really painful implementation. It has not gone well, and the medical device industry is totally fed up with regulation currently. And it's really hard to propose any new regulation legislation to that company. And when they complain, they really have a good case to say that, no, we don't want any new regulation. This is my hypothesis. Again, I think from that reason, medical devices are excluded from EHDS. Next slide, please. However, I think it's really interesting to get to the business model, and it might be applicable for medical devices. Next slide, please. This is again from the EHDS definitions. Manufacturers of EHR systems and products are to bear the cost. So I think they said was it 0.1 billion, so 100 million to implement the system, and then up to 1.2 billion to these manufacturers. So again, you put a lot of stick and less carrot. Next slide, please, to the industry. So I think to compensate for that additional burden, we would actually need some carrot too. Next slide. So brief glance to what SensorTrend does. We already take data from wellness apps and devices and also medical devices, and we feed that data into an EHR. Next slide. And we also have other apps. Click 5 times, please. Like this care plan application that also takes data from various sources and then feeds it to the EHR. Next slide. However, there are dozens of different apps, even for people with diabetes. And I think it's really important to see a market where there would be dozens of different apps integrated into the healthcare system. Next slide, please. So that each patient would find the one that suits their needs best. And one of the issues is how the healthcare professionals interpret that data. There's harmonization there as well already. So this is the ambulatory glucose profile that takes data from whichever app that has written it and shows it in a harmonized way. Next slide, please. And this is really the market that we'd like to see, that there would be a marketplace for many different apps, both for patients and some for clinicians as well, and combined data store. Next slide, please. And we are seeing some of that, and you can click 3 more times. So there are different app stores already for different EHR implementations. So these kind of catalogs are coming up. And next slide. Even better, we do see these in modern regulation, like the PCON model in France. They already have this legislation for remote monitoring apps. So next slide, please. They do have these standard reimbursement rates for all the telemedicine products. And next slide, please. Another interesting point is the DIGA model in Germany, where they reimburse apps. Doctors can actually prescribe apps, and the healthcare insurance companies pay for those use. So in this case, 1,000 euros per patient per year. Next slide, please. So finally, what would be the role of the European EHRxFormat in this? Next slide, please. My guess is not too much. I don't think it's really important to define a structure for this data. We already have a good international one, HL7 Fire, and what's really important or crucial is the smart app launch specification that talks about how do you integrate these either wellness apps or medical devices with the EHR. Next slide, please. And there's also international patient access specification that talks about the data that's relevant for patients. How do they write that to the EHR system? How do they read it from the EHR system into different apps? Next slide, please. And one important or nice example of that is the Apple Health that uses the IPA standard to fetch data and show it in your iPhone. And Common Health is doing the same for Android. And that works really beautifully already in US, and I'd like to see us adopting the same one. Next slide, please. So the open question is, do we need to tailor these international standards, HL7 Fire, Smart App Launch, International Patient Access for Europe alone? And I think, no, let's just adopt the wide international apps specifications. Next slide, please. Thank you.
Thank you. Thank you very much, Mikael, for your presentation and some of your provocations. I really like the slide where you say maybe only 5 or 10 to warm up our debate. Maybe our participants can also raise their bet if they think it's 5, 10, 20 or more. So you see what's the reaction from our audience. You know that. And I think you put the point very interesting, which is if wellness apps are there not to contribute to healthcare, and devices, medical devices, are naturally closer to the EHR, let's call it this way, why are they not in Article 31A? One, and why do we have the wellness apps? But my first question to you and then maybe to Petra, and then we will continue, is you did say that you actually like label to enable. I don't know if you were just being nice to Petra, or actually you like the labeling of apps from a sort of a end user's perspective and prescriptor. You also talked about the importance of having signals to the prescribers, in this case, not choosing. I wonder if you think there could be a label to enable too, looking at using that label to tell us, is this app fitable, connect to an EHR, if in case this narrow margin where it's not healthcare, but it's care enough to matter to connect to the EHR, or if the EHR in a way can be a wellness repository, wellness data repository, and it's the so what's more wrong? Is it the definition of the EHR that perhaps needs to be broadened to encompass all types of data for the patient, from the patient, about the patient, that might be relevant, including wellness information? Or is it the definition that those that are not for care provision enough? What's your take on that? And then I'll go to the question.
I think the point here is especially that it's relevant for medical devices. EHR integration is much more relevant for medical devices than for wellness apps. And I've been part of the Nordic interoperability project that was drafting a application accreditation criteria for the Nordic countries. So the 4 Nordic countries in scope, and they took the label to enable was worked on and at the same time, but they have many of the same sources like what ORCA has done in the UK. And in that Nordic interoperability project, they really wanted to add the question, okay, how do these apps integrate with EHR systems? And I think that's really valuable and that should be done. But again, it's much more relevant for medical devices and much less relevant for wellness apps.
Thank you. So, Petra, I'm going to throw at you one question that Vicent Berg add to our chat. So, medical devices are excluded from the EHDS, and you said it. But some electronic health records are called software as a medical. So, and I guess if you would call it wellness apps as a medical, should they follow the European Health Data Space definition? What's your impression on this? If things fall under 2, how do you combine them? Sorry, you muted, Petra.
Yeah. Labeling is indeed limited to wellness applications. So Article 31 is limited to wellness applications, but medical devices are mentioned, including in the preamble, 45 times. So it's a bit of the way my focus has been more on wellness application because that was about labeling. But it's not. In my understanding, it's not that medical devices are excluded. It's just that the way that we're recognizing whether they comply, whether they comply. Yeah, I'm not sure if I should use compliance, but whether they fit the needs of the European health data space is done somewhat differently than labeling. I did see that so I've used what I think is the latest version of the regulation text. The latest version will come later this year. But there have been some changes, and elsewhere I do see that there are similar, or yeah, at least in part similar requirements to medical devices, which are indeed much more logical to connect with the electronic health record. On the other hand, already in 2019, I was at the American Society of Clinical Oncology, and they found out that for cancer patients, the minimum number of steps a day, which is very wellness, said more or less the same thing as the outcomes of a quality of life questionnaire. So there are possibilities. Are they already hugely used? No. Will doctors take them easily on board now? No. I would say largely, if I look at what the Standing Committee of European Doctors mentioned, they would like to have CE marked devices and ISO certified. But I would see this largely as but we want to enable the patient to upload their data as well.
In this discussion, health and wellness apps, I mean, aren't they these artificial separations? Don't we see that at some point in time, something that was supposed to be a wellness app suddenly does some recommendations or does some guidance? Where is the boundary? Where's the boundary? And will these apps stay wellness or health and not cross?
Not necessarily.
over?
No,
Well-
it's we actually spent quite some time when we created A2304 Part 2 on where exactly is the boundary, but on an international scale, that's really difficult because what is a medical device in one jurisdiction may not be a medical device in another one. So we left that topic at the time. Yes, if you add certain features, then suddenly you can become a medical device. Also, you see now that, well, what do I need to take out? So I'm not a medical device and I don't have to comply with MDR. So it does have, so far, the rigor of MDR seems to have an effect on, let's try and deviate somewhat, take out a few features, and then we're not part of that scope.
Mm-hmm. Yeah, is this good or bad? I mean, you had also raised your hand on the previous question, but I want to also your brains on this.
Yes.
So if the bar is too high, both on the MDR or in the interoperability landscape, would we be pushing the industry to actually offer less sophisticated products when it could offer more sophisticated products, including AI-driven recommendation, just so that it goes below the radar? In this case, below the radar of the electronic health and MDR and the European health data space, just stay where it is.
This is a very critical point, Henrique. Let's say that a health app is an app which provides something extremely related to healthcare. Its intended use falls under the MDR and thus should be certified as a medical device. Wellness apps and fitness apps are meant for other purposes. Okay, so as Petra pointed out, they fall under a different topic, and thus they do not have to be certified as medical devices. However, from my point of view, the point is giving for granted that the suppliers always choose the correct intended use, and thus they fall into one category or another. The point of my presentation was, how do we identify a pathway for wellness applications, for those which are not medical devices, to be able to be integrated into electronic healthcare records? Now, the pathway that I see and many others see is to identify criteria for asserting and assessing their quality of wellness applications. Now, in A2304, the technical specification, quality and reliability of health and wellness apps, we took some decisions and some assumptions. in which the quality criteria could be applicable to both health and wellness apps. So from that point of view, we sort of chose a certain pathway. In any case, the difference between a health and a wellness app, it depends on the intended use of the app itself, which was declared by the supplier, and whether it falls or not under the MDR. Just to answer a question you made before, why did I bring in the word consumer into my presentation? Because electronic healthcare records are being opened on a worldwide basis to the consumer. A certain section of the electronic healthcare record, section which is not dedicated to the healthcare provider, the clinician, is allowing the patient to actually upload information. When a patient goes to a doctor, he may say, I have headaches. Now, there's no medical device which actually measures headaches. And the fact that they can use wellness applications to actually transfer their fitness data or their well-being information, the steps taken to their clinicians in the electronic healthcare record, should be seen as a positive thing. Now, this has to be well taken care of. I mean, you just can't add any wellness application. It has to fall under the certain quality criteria and being assessed for that. Okay. Hope now it's clearer.
Thank you, Pierre. Yeah, thank you very much. So I'll summarize later, but over to you, Mikael, since we only have 3 more minutes, so I'll give you 1 minute and then I'll try to wrap up. And, you know, time flies as usual when you're having fun.
Well, just to spur the discussion that we can continue, for instance, in LinkedIn or YouTube after this, I would challenge you, Pierre, when you say that there are no medical devices for tracking headaches. I think there are. And the point is really, do you want then as a healthcare organization to invest in those apps that have gone through MDR and are actual medical devices, and you need to procure them and pay for the manufacturer, or do you just want patients to kind of give their data without needing to pay for them? So I think business models here is the crucial question. And there are medical devices, and the medical device industry really wants to preserve that, their advantage. We've paid a lot for these certifications. We should be the ones that get reimbursed for that.
So if I understand correctly, Michael, what you're saying seems to me is that, of course, this is not just a matter of data and quality of the data and the way we exchange data. There are legitimate interests in creating silos that create different levels of service. So I think your example is very interesting. So I could have an app where I report my headaches. I could have something a little bit more sophisticated that somehow would measure mine.
Yeah, even if you report your headaches, if a doctor uses that information to diagnose a disease for you, then they are using it to diagnose, and then it needs to be a medical device if they use that app for that purpose.
Yeah, but it's, I think, and to summarize our discussion, I have to tell you that as an internist, you know, internists, doctors such as myself, we tend to integrate everything. And for me, you know, although I went all my way to study digital and law, I still don't get it. You know, why so many silos in something that seems to me as a continuum? I cannot understand how steps are not part of health. And therefore, the difference between wellness and health it seems so far away from what we are projecting into the future in terms of what is today the discourse about prevention and wellness as the first step to health. So I would like to answer the question we launched to the webinar: how can the exchange format help? Well, maybe it can create a continuum of integration. And I think for me, one of the words that Pierre included here is maybe it's not to integrate or not wellness apps, it's to integrate a good quality ones, the good quality devices, and the good quality medical. And maybe if the data has been well collected, why not? As Petra was saying, we collect it for wellness, but if it's for healthcare, you can't. But if there is a legitimate, or at least a future projected purpose for that data that we are now collecting and aggregating in EHR, even if we now don't know that it might be useful into the future, that again could give meaning. So an expression that the Americans like a lot, right? But it was very famous, meaningful use. So in this case, meaningful exchange. If there is meaningful, high quality exchange, the format could help define what is meaningful, high quality data exchange. Perhaps we can find a bridge between wellness apps, health apps, and medical devices, and the route to the EHR. Let's see. It's early days. We can build this. The implementing acts, the delegated acts are not out yet. And as Petra pointed out right in the beginning, there's a lot of question marks that can be explored, and as we call it in law, interpretative law, and using the recitals as a basis for that clarification in the next coming detailed implementing acts. Thank you, the three of you, for preparing such good material. Thanks for warming us up with this good discussion for the summer. And thanks you all for all of you that join us today. And of course, as has been mentioned already, you can please connect to our participants. There was one or two questions that unfortunately, Xavier, we couldn't go to all of yours, but thanks for the questions. And please reach out to any one of our speakers online.
Henrique, do you want to say where we can continue discussion? For instance, put in the chat one of the links where we advertise this seminar in LinkedIn, and we can continue there.
Yeah, we can do that. Yeah, that's a great idea. Let me do that right now. It's a great idea, and that's a good way to finish. Please follow. And just see how I can do that. Actually, I can only reply.
Radhika said that she will do it.
Okay. Thank you. So thank you very much. Have a nice summer, and we'll be back after the summer with another webinar. If I'm not mistaken, is on the 16th of September at 3 Central European Time, and with PM, not AM. And we are going to debate a very interesting topic: open EHR with or versus FHIR, and how to promote better medical record keeping and supporting the healthcare professional. I think it's going to be a hot one as well as this one, and very interesting topics. Thank you so much for joining us, and see you online. And please follow XpanDH project and all the work we're trying to do to expand the understanding and the use of the European electronic health record exchange, a vibrant digital health ecosystem across Europe. Thank you.
Thank you for organizing this.
Thank you.
Thank you.